Hi everyone and welcome to this new IDF webinar. My name is Chani from the advocacy team here at IDF, and our topic today is traveling with diabetes. We think this topic is really relevant and important for those of you who will be joining us in Busan for the YLD Training Summit, but it also of course applies to each and every one of you that are present today, as you may have or had the opportunity to travel, and we think it is safer to be educated on that topic so you can plan ahead and enjoy as much as possible your new adventures. I am joined today by two speakers, Lisa Duc and Abba Condel. So a quick overview on their background, starting with Lisa. She has a public health academic background and is a certified diabetes educator. She has worked in maternal, child, and adult health educations for over 20 years, and most recently in diabetes research, program planning, and implementation. Currently, she is the lead of IDF's iHealth strategy. And then we have Abba, who is IDF epidemiology assistant. She has a medical academic background and 4 years experience in the fields of medicine, surgery, clinical microbiology, and public health methodology. She is currently working in epidemiology and data sciences at IDF. So we will, of course, have a Q&A session at the end, as always, so you can ask your questions to the speaker. And I invite you to use the chat and the questions tab on your right, so we can read and answer your questions at the end of the webinar. So I'll quit talking. So welcome Abba, welcome Lisa to this webinar, and I'll now turn the floor over to Lisa.
Thank you, Chani. Hi, everybody. This is Lisa, and I'm getting over a cold, and so I apologize for the quality of my voice, and we'll see how this can actually impact if I would be healthy enough to travel myself. So this is a pretty good webinar. So we're going to cover a few things. Why are we even talking about this topic? What to do maybe before you travel, what to do while you're traveling, and then once you've reached your destination, some things to think about. So most people have done some traveling, and it's done, and many people around the world really love it because it's so fun and it's so interesting. And just because a person has diabetes doesn't mean they should just stay at home. And so, but it is a consideration. So it's important to remember that with traveling, inherently, it might involve some delayed meals. Think about having meals on a plane and having their schedule and not yours. It could be unfamiliar food, which might not sound great, but in terms of it, you can put it around and flip it around to exotic foods and new and interesting flavors, which are terrific. However, you might want to be a little bit mindful of them in light of having diabetes. When we travel, in some situations, we're actually more active than we are at home, or sometimes even less active than we are at home. And so that can impact how our diabetes is managed. If a person travels across time zones, that impacts anybody and can have some special considerations for people who have diabetes. So we're going to be talking about these in a little bit more detail. And just because just because you are on vacation doesn't mean that your diabetes is, unfortunately. However, with just some extra thought, some good preparation, you can have a fabulous time on your trip. So a few things to keep in mind before you travel is to actually have a checkup to make sure that your health is good enough to travel. That's really, really important when a person has diabetes or anything. And because even when a person is super healthy and doesn't have a cold like I do, traveling really can take a toll on a person's health. And so with diabetes in the mix, it's important to make sure that you're up to date with your checks with your doctor. And we'd like to go into that a little bit more detail. So when you have an appointment with your doctor, maybe specifically about your traveling, tell your doctor even ahead of time that you're going to need a report or a letter from your doctor that shows that you're currently under their care. And this letter would include the list of your prescriptions. And this is actually quite important. And I have an example in a couple of slides up that shows an example of what the letter could look like. Your doctor may already have something that he or she uses, and that's fine. We have spoken with people who travel extensively and who have type 1 diabetes. And so a lot of these tips come not just from research, but come from the real world travelers, if you will. So also, especially if you're going to be going to Busan, and you don't already live in South Korea, it's probably a good bet that you are going to change time zones. And in addition to just dealing with jet lag, your doctor may want you to adjust some of your medicines, some of your diabetes medicines, and the timing of taking them. And it's important that you understand what changes you need to make, if any. Also, with your doctor, talk to them about what your activity level is likely to be when you reach your destination. Are you usually quite active, but now you're going to sit hours on a plane and then sit for much of the day during presentations? Or are you usually pretty sedentary, but when you get to Busan, you're going to be walking a lot more than normal? You plan on walking or running that 5K. And so just talk about with your doctor what your activity level might be and if there's going to be changes. Because a person may need to make some adjustments in their food intake, or even in their medications. My colleague Abba has come up, has come up with a great link here that you can check out, and it's with the Center for Disease Control. And they have a really great section on travel health, and that includes a section for people who travel who have chronic conditions. So as promised, I have, it's broken into a couple of different slides, but some things on that letter with your doctor, or a letter from the doctor, things you might want to have included on it, that it's on their letterhead, so it looks quite official. And think about this letter is going to be shown perhaps at the airport and through security, and they're going to need to know all this information from your doctor. So that's the reason for having a letter or the latest report from the latest visit from your doctor. So it's pretty basic, actually, in a lot of it. The doctor's information, your information, and things like that you can see. And here is some potential content for the letter, to whom it may concern. Again, that's that person at security, right? And so there's a couple of sections here that have asterisks that are followed up on the subsequent slides. But there's a something that you may not have known is that X-ray machines can damage certain certain diabetes-related components. And so if you wear those, like an insulin pump or continuous glucose monitor, those sorts of things could be damaged going through an X-ray machine, and so you would need to request a hand scanner, and your doctor can indicate that on the letter. Also, it's important that your doctor mentions the fast-acting carbohydrates that you need to have access to, whether that's in the form of glucose tabs or sweetened drinks, things like that. Then their signature and their stamp is really, really important as well. So a couple of more details might be that it's important that your doctor lists out all the pieces of equipment that you will need to be able to have on your person, so that your passage through security is as smooth as possible. And I'm not going to read all of the list here, but yes, even your lancets, any of those things that are sharp, in addition to your needles, just anything that could raise an eyebrow. Also your insulin and everything like that needs to be allowed to be kept on your person, and we'll talk about that a little bit later. And as I had mentioned, again, from your doctor, they're mentioning any of the equipment that you have, monitoring equipment or insulin equipment, that should not go through the X-ray machines or the full body scanners, and because it could actually damage or break them. And here is another great link from the CDC, the Center for Disease Control, and that you could find out further information. And one thing that I did not mention also to ask your doctor about was if you are up to date on your immunizations. Any person needs to be up to date on their immunizations. Any person living with diabetes definitely needs to be up to date on their immunizations. Anybody traveling who has diabetes must be up to date on their immunizations. And the CDC website that we have linked for you will let you know what you can look up on just about any destination, and they can tell you there what immunizations are needed for those locations. And so that would be really important to discuss with your doctor. Coming on to this slide, so everything that I've talked about up to this point is, talking with your doctor and things like that. We'd really encourage you to collect information, and much of this information is available online. You may just need to do a little bit of digging, but you might want to think about what type of food are you liable to have available to you at your destination, such as in Busan. And you can start thinking about what will fit into your meal plan and what other preparations might you need to make. And you might want to check out what pharmacies and clinics are close to where you're staying. I was speaking with somebody with type 1 diabetes recently, and that is something that they do each time they go traveling. You might want to think about some basic phrases, let's say in Korean, and even have them written on a small card. A phrase like, I have diabetes, or where is the closest pharmacy? Because if you're needing to know where the closest pharmacy is, you may not be thinking about or remembering that particular phrase to speak it. But if you have it on a card that you can show somebody, or even someone in a restaurant, I have diabetes, then that can be that can make your life a little easier. You might want to consider looking into getting medical alert jewelry, like a bracelet, a necklace, or a card that states that you have diabetes and any other health conditions that you might need someone to know in the case of an emergency. You might want to look into getting travel insurance in case you miss your flight, or if you need medical care. And something else, if you're traveling on a plane or a train and might involve meals, check with your airline to see about ordering a special meal that would fit with your meal plan. A tip there would be to also bring food for yourself in case that request doesn't go through. But so just having some food that you have packed as a bit of a backup. I would like to now turn it over to my colleague, Abba.
Thanks, Lisa. Here is Abha, and firstly, I'll talk about some packing tips before traveling. Packing is really an important part of traveling, and it should be done very carefully. So, if you're traveling by flight, so make sure that keep all your diabetes supplies in a carry bag, and avoid keeping it in a checked luggage because it might get too cold in a checked luggage. And secondly, you should carry double the supply you need because it is better to carry the more supply. Otherwise, there can be a challenge to find the particular medicines in a different country. So the other thing you can do is you can carry medicines in the pharmacy bottles, and even you can ask your pharmacist to print some labels and attach it on the plastic bags. The most important is the food. So pack some healthy snacks like fruits, raw veggies, and nuts. So I would recommend that before traveling, you should actually consult your dietitian because they are expert in all this kind of stuff. And your dietitian might tell you what kind of food suits you and what kind of food is available in a particular country. Like if you're traveling to Busan, so it will give you an idea that what kind of food you can pack or which is not available there, and what kind of food you can eat there, and most important, you should avoid there. So apart from this, you can get some more information. There is a site, the Travelers Health site. The beauty of this site is you have to select a particular country. For instance, if you're traveling to Korea, select Korea. That site will give you an additional information which is required before traveling to that country. For example, the information regarding the vaccination status or any other relevant information which is important for a person who has a health challenge. So, and apart from this, there is another site which is an International Society of Travel Medicine. Actually this is a site here. All the practitioners, they work for the prevention and the treatment of the international travelers' health challenges. So you can get some additional information. We would really recommend that you should follow this site and try to search all the relevant information which is available and be prepared for your travel. So before traveling, we will talk about while traveling status. So at the airport security, there is a special card which is a TSA notification card. So this card is actually very helpful to speed up your security process. So the full view of the card will be available in the next slide. So people and the most important information is normally you might be knowing that there is a rule of 100 ml liquid rule for traveling via flights, which is allowed. So, but the people with diabetes, they are exempted from this rule. So they can carry even more fluid, liquid above 100 ml, and even the fast acting caps like juices, and they are allowed to take gel packs to keep insulin cool. So check with your airline how much of these you can carry with you. So these things it should be done before traveling. You can, even if you have booked your travel tickets, you can connect with your customer care and get all the relevant information regarding these fluid levels. So the X-ray machine, you might be knowing that during the security process, even my colleague Lisa, she has discussed in the previous slides that you have to go through the X-ray machines and for the screening and all. So while that procedure is going on, your insulin pump and the glucose monitor, it might get damaged. So in that case, you can request the security for a hand inspection checkup, and even you can show your TSA notification card, which will speed up your process. So this is the view of the TSA notification card. This is the front view, and it is clearly mentioned that if you have any health challenge, anything else, it will be written in the space provided, and you can show this card at the airport, and it is really very useful. This is the back of the card. So the information is given, and even the site is provided here where you can go and collect all the relevant information. So apart from packing, it is very important that how do we pack in a right way. So if you're driving, so pack a cooler with the healthy foods and plenty of water. Don't forget that water is really very important, because, and especially if you are traveling by flight, and make sure that you refill your bottle after the security. So keep your diabetes medicines, monitors, and test supplies out of the contact of the sun, and also not in a hot car. It might damage the appliances or the medicine. So keep the medicine in a cooler, and keep your insulin and supplies uh, uh, out of direct contact with the sun and in a gel pack. So you should plan your strategies in place. For example, you can find healthy food options like at the airport or at the roadside restaurants. And I have already mentioned you can make a full plan. You can ask your dietitian. He or she can guide you what kind of food you can eat or what kind of food you should avoid. So you already, if you have the checklist, it is easier for a person to get the food. Otherwise you always keep on person always keeps on thinking that what should I take, is it good for me, is it not, or you might search via internet and you may not get the correct information regarding the food. So we would really recommend that you should follow the schedule provided to you by your dietitian. So, and the most important thing is the people with diabetes, they have the tendency of plaque formation, sorry. So it's the people with diabetes, they are at higher risk. So it is to avoid this medical ailment, it is recommended that if you are traveling by car, stop after every 1.5 hour or 2 hours, and take some walk of maybe 2 to 3 minutes or 5 minutes. And if you are traveling by plane, so you should walk up and down the aisle of the plane or train every hour or two, so in order to prevent these blood clots. So And the next thing is we would recommend that you can use the alarm on your phone for taking the medicine, because if you're traveling across different time zones, your doctor, he or she may recommend staying on your home schedule for some of your medicine. So you might forget to take the medicine on time. So to avoid that, you can use the alarm on your phone. So finally, at the destination, what all things we need to take care of? Your body will need to adjust. You know this thing very well. So your blood sugar may be out of your target range at first, but your body should adjust in a few days. So the important thing is you should check your blood sugar more often and treat higher and low levels as instructed by your doctor. So if you are going to be more active than usual, then even if you are less active than usual, the important part here is to check the blood sugar levels more frequently than normally you do. And you will feel best the closer you stick to your meal plan. So meal is really, really very important. So at the destination like Korea and other places, the stress of traveling may impact how your body uses the insulin. So you may need to test the sugar, as I already mentioned, and adjust your insulin dose and what you eat and drink. So some of you will be in Busan in December. Expect that it will be cold there. So do not forget to take your lotions, gloves, lip balms to protect yourself from the cold weather. And people in South Korea, they do have diabetes is like all over the world. So however, your type of medicine and supplies may have a different name. So because even if you are having taking the same salt with a different trade name, that country might have the same salt with another trade name. So if you are getting a prescription from your doctor, you can request your doctor to mention the salt of that medicine rather than the trade name, because trade name varies from not even from country to country, even from city to city. Even in a one country, the same salt might have 100 plus trade names. So the most important is salt. So you should ask your doctor to provide you with the correct salt of the medicine. So you can do some research to learn more about the specifics of your destination. So at the end, I would like to conclude that diabetes can make everyday life and travel more challenging, but to keep you close to home, lots of people who have diabetes travel, the more you plan ahead, the more you will be able to relax and enjoy all the exciting experiences of your trip. Thank you.
Thank you, Abba. Thank you, Lisa. I know, especially for you, Lisa, it wasn't easy with your voice today, but special thanks to both of you for accepting our invitation and for sharing your knowledge and insight on this topic, which is of great relevance to our two networks of people living with diabetes, both BCV and YLD. We know some members are really used to this and travel sometimes as part of their jobs. But also we know that some other members might not have had the chance to travel abroad just yet. And we are dedicated to make this education available for all of you, and also so you can share it afterwards with your own networks, and so that everyone is educated on this topic. So we will now start the Q&A session. I think we had a few questions during the webinar. So let me check that. We have a question from Jerome. In Africa, where we travel to hills, where even water is not available, what can we do?
Wow, that can be very challenging. It's very important, as Abba said, to have water with you. So if it's not going to be available reliably at your destination, I guess traveling with it will be very, very important. And to identify also other safe drinks that you can have.
And even we can carry extra bottles of water. So if you think so that it can be challenging, so rather than carrying one bottle, we can carry 2 or 3 bottles to avoid that challenge. But I think so. I mean, it should be available because now the things have changed, and it should not be a big problem.
Yeah, I think what our speakers are trying to say is that the best thing is really to plan ahead and to pack depending on your trip. So if you know that water will not be available, maybe you can restrict your trip to a few days so that you ensure that you will have enough water for the length of your trip. And this applies, of course, to any supply that you need. We have an additional question from Bilgisa, who is asking, with our insulin, how will they let us travel? Because sometimes with the solutions, it is difficult to make them understand. I believe you are referring to maybe staff at the airport, security staff.
Yes, I mean, if you can get the that TSA card, it would make your life easier because you need to show at the security the prescription by your doctor. Even if you can carry the accessories like the any card or the necklace, which can signify that you have a health challenge, I'm pretty sure that it would make your life easier.
In addition to the letter from your doctor, I think both of those things might really help.
Mm-hmm. Yes, and for the letter from your doctor, I think it's good to have it, if possible, available in the language from your departing airport, but also maybe in English, because when you're traveling abroad, English is the mainly spoken language, so it's always good to make sure that the staff is able to read the documents that you present to them.
That's a really good point, Shani.
Another question from Mohammed asking, is there any alternative concerning insulin packing?
Alternative to insulin packing. I'm not sure of the question. However, the point was not to pack your insulin in your luggage that's going to get checked, because the hold of the airplane is extremely cold and it would be too cold and it would inactivate your insulin. So write us some more if that doesn't answer your question, please.
Thank you. Sarah is also asking a question. Hi from Tehran. Hi, Sarah. Can you please give more information about what we should do if we want to travel in another time zone, especially for long-term insulin?
Yes, we intentionally did not go into great detail here because there are so many kinds of insulins, and that it's really best to speak with your doctor when you speak with your doctor, to talk with them about where you're going and what the time change is, how many hours different ahead or behind. Some people stay on their home schedule for their basal insulin, and then for their mealtime insulin that changes. But again, that's some people. So it's really best to speak with your doctor.
Indeed, yeah.
Another question from Johanna. Hello, hi Johanna. Would like to ask, I'm on the pump, so before hitting the X-ray, I should tell the security to do hand check. What if they insist on going through the X-ray? Will the pump get motor error?
I mean, there are chances that the pump can have some damages or whatever, but it's not a rule. But you can ask the security that you want a hand checkup rather than going through the X-ray machine.
And again, the documentation to support you is very, very important. You might call your airport ahead of time and speak to them also to see if they have special rules or considerations.
And in addition, I would like to say you can contact the customer care service before traveling, so you will have all information before you travel. It would be useful for you.
Thank you. Another question from Ines. When to change the time on insulin pump if the flight is few time zones differences and you are staying a few days? So I believe you are asking, wait.
To talk to your doctor.
Yes.
Yeah.
I think for
Yes,
this specifics,
definitely.
it's better to consult with your healthcare professional on this.
Because he knows in detail about the status of your condition and all, and he will be able to answer it in a better way.
Thank you. Derek is asking where to get the TSA card about.
The link is already provided. You
Yes,
can
so we
search,
will
yeah.
provide the slides after the webinar, and you can click on the link to order the TSA cards. Mohammed, I meant if there are any other ways to pack insulin other than gel or the known equipment needed. What can I use if they're not available? I think for this, for specifics, again, it's better to ask your healthcare professional who might have information that is more relevant to your local situation, as this varies from one place to another.
And it also varies to the insulin itself.
Yeah.
Some insulins have to be kept cold or kept cool, and then once they've been started, then they don't need to be cold any longer. It really depends on what you are using. So yeah, go back to your doctor for that.
And we have a final comment from Veronica, who's saying that she, even with very unrational airport security, she has never had a problem passing through security, and that mostly they get concerned for not have acted appropriately from the beginning. So we are very happy that you've never had any unpleasant situation, and it is still good to know that this may happen. That's why it's better to plan in advance, to plan ahead, so that everything goes smoothly. And for all information related to the TSA card, again, we invite you to go to the link that will be provided right after the webinar. I think we have answered all of your questions, and if you have any other questions while you are watching the webinar, we of course invite you to send a message to advocacy@idf.org. We'll be more than happy to answer the questions and to forward them to the speakers if needed. So again, a big thank you to our two speakers for accepting our invitation today. Thank you for everyone that attended this webinar today. A quick reminder for the YLD Trainees 2019. There is one final step to complete now. Please respond to the feedback questionnaire that you will receive in a few minutes in an email. As always, you have 2 weeks to complete it, and do not hesitate to contact us at advocacy@idf.org. So remember to plan ahead your trip so you can enjoy it as much as possible, and we'll see you very soon on another IDF webinar.